Hello, everybody. My name is Dr. Amir. Today we are talking about what plantar fasciitis is. I have many patients that ask me what it is, and I thought this would be a best way to actually give you a little information about what it is and what we can do to help you with the pain. Plantar fasciitis is actually a very interesting diagnosis because it really is a continuous overuse injury. And how it presents is it presents with a pain in the heel uh, or in the medial portion of the foot. And one of the very crucial uh, symptoms that I hear all the time and that determine over 50% of the time when the patient tells me I have pain immediately after waking up in the morning. And that would be pretty much a hallmark of having plantar fasciitis. So we are going to talk to you about what plantar fasciitis is and what we actually see in the patients is I have a lot of patients that they are runners or dancers and a lot of ballerinas especially that they have a lot of overuse activity. By overuse, I mean they are working on their foot, pounding on the hard surface, runners, dancers, and that can cause the plantar fascia, which is the bottom portion of the foot, to get inflamed. And that can cause micro tearing of the fascia, which can lead to the irritation and inflammation of the tissue. There are other contributing factors, including tight muscles in the posterior compartment of the leg, like the gastric muscle and soleus muscle, and lack of proper conditioning before any activities like stretching, or if the muscles are not warm enough. By warming up the muscles, you need to do stretches before any kind of activity, because if the muscle is supposed to be elastic, have that elasticity in the muscle. If the muscle is not elastic enough and it's really dry and it's dehydrated, can the fibers of the muscle cannot open and have like a shirt that if your shirt is you put it out and get it dry, a dry shirt, it's very hard to maneuver. Once when the shirt is hydrated, if you dip the shirt in the water and that shirt has elasticity and it's easily bendable, it's the same thing with the muscle. So these contributing factor can lead to having plantar fasciitis. There are other contributing factors, which is diabetes or overweight person, or any degenerative changes or loss of elasticity, as we talked about, in the fascia. And extremely high or low arches, for example, can cause and can lead to the plantar fascia to get irritated and can cause chronic pain if it lasts more than 2 to 3 weeks. It actually turns into a chronic pain. The injury to the plantar fascia is mostly commonly seen on the inside of the medial portion of the fascia, which connects to your calcaneus, which is right on your heel. So there are two bones that sits on top of each other. One is the calcaneus, which is your heel, and one is your talus, which sits on top of the calcaneus. So imagine if this is your calcaneus and the talus sits right on it. At the bottom of your foot, there are fascia that is connected to your toes and all the way extend to your calcaneus. If that fascia is tight, or the muscles in the posterior compartment of the leg is tight, that fascia gets pulled and it can cause micro tears along the fibers of the fascia, and that micro tear would ultimately cause some sort of site in like a local area bleeding, and that bleeding because the body has to uh, prevent any re-injury of the tissue and has to heal itself, it brings a lot of calcium in that area. A lot of calcium in the area of the inflammation can cause the calcium deposits. When the calcium gets deposits in the tissue, which is the fascia around the tendons of the muscle, usually at the beginning we don't see that on the x-ray because it's a cartilaginous material, like your joints or your it's a cartilage, like the fibers of any tendon. And as the time passes by, let's say 9 months to sometimes even it takes up to a year for that calcium deposit to show on the x-ray. So at the beginning we can't see that on the x-ray, so the patient presents usually with pain and especially upon waking up or when you first put your foot on the ground, upon waking up you have pain, and it becomes chronic if you don't do anything to treat the pain, and if the inflammation persists for over a couple of weeks, that inflammation and the calcium that gets deposited into that tendon and into that fascia can cause a serious damage to the fascia and the tendons, and that calcium deposit become bone, and it's called bone spur, and that bone spur would be apparent on any x-ray from 9 months to over a year after the injury. So you would want to take care of that, and you would want to get treatment as soon as possible. Now, in the overstretching, overstretching of the fascia by overuse activity can cause micro tears on the plantar fascia. At the attachment side, which is the calcaneus, and on the attachment side, when we have that micro trauma happening in the fascia, then that bleeding is what causes the inflammation. And inflammation, it's going to be painful no matter what. At our clinic, one of the first things that we do, besides normal icing the site of the pain, is we do ultrasound and electrostimulus combination on that site. So if you have a lot of inflammation, a lot of pain, the ultrasound is going to decrease that inflammation and close that pain gates for you. Within 2 to 3 sessions, that pain should be almost half. And we also do laser therapy. Laser therapy, it increases the circulation of that inflammation site, and increased circulation would decrease that inflammation by 50% after first session. So I hope this answered many of your questions. If you have any more questions, please either like us down at the bottom of this page, or you can always write to me. My email is Dr. Banishahi, BANISHAHI @AOL.com, or you can call me at 678-401-3803. I'll be more than happy to answer any question for you. And keep up the good work, and we'll see you next time. This is Dr. Amir. I'll talk to you later. Bye-bye.